Welcome to this week's flashcard presentation on herpes zoster. Let's discuss what herpes zoster is. Herpes zoster is a common viral disease that affects people of all ages, and according to the CDC, 1 in 3 people in the United States will develop shingles. The risk is increased with age and immunocompromise. So when a host is exposed to the varicella virus, the initial exposure is known as chickenpox. After chickenpox sits dormant in cranial nerves or dorsal root ganglia and is reactivated due to a stressor, it presents as shingles or herpes zoster. So the etiology of herpes zoster is a reactivation of a virus that can replicate in the neuronal cell bodies and sheds virions from cell to cell. The virus is carried down the nerve to the skin area that is innervated by the infected ganglion. The pathogenesis is varicella zoster virus is a primary infection that enters the host and develops into chickenpox. Infected particles will travel along a neuron to the dorsal root ganglia, cranial nerve, or trigeminal ganglion, causing a latent infection. If a person is immunocompromised or has a weak immune system, the varicella virus can be activated, and this will happen in the dorsal root ganglion. At this time, the virus spreads intraneuronally and makes its way down one spinal nerve or dermatome, causing peripheral or central nociceptor sensation. During this process, the dorsal root ganglia is causing neurons to necrotize or die, and there's damage or destruction of sensory neurons, causing a disruption in nerve connection between skin cells. As the virus spreads, pain signaling and overactive pain sensation occurs. The virus spreads by cell-to-cell mechanism by using self-produced glycoproteins to attach to uninfected cells and inserts its viral DNA into unexposed cells. Virus replication continues and creates groups known as syncytium. Because the virus spreads inside the cell, the antibodies that would typically be produced if an antigen was circulating in the bloodstream, they're not produced. For this reason, cell-mediated immunity is necessary because instead of using normal antibodies to attack the antigen, the body will use the immune response of activating the macrophage and the natural killer cells. When these are produced, antigen-specific cytotoxic T cells will release cytokines that will respond to specific antigen. The virus replicates inside the cell, creating a virion, which will then attach to another host cell by the way of the mannose 6-phosphate receptors. While this is all happening during the primary infection, sensory neurons are affected, and the virus can stay latent. The dorsal root ganglia, cranial nerve, or autonomic ganglia will hold the latent virus for an unknown period of time. Sensory neurons can be activated by various reasons, such as a stress response, and the particles of the virus will then be transported down the sensory neuron during a reactivation phase and present via the skin as lesions known as shingles. So now let's go into the risk factors. So the most important risk factors for contracting the disease is age, because after the age of 50, incidence raises dramatically. Another risk factor is having been exposed to the primary varicella virus known as chickenpox. Risk factors include host immune status, because as the person ages, they become more immunocompromised and susceptible to reactivation of the latent virus. Also, the immunocompromise is related to a reduction in T cell mediation, and this plays a role in decreasing the immune system's response to an antigen. So T cells have antigen exposure memory, and they can destroy virus-infected cells, and when the immune system is compromised due to age, the risk for the varicella increases. Also, things that impede immune response are autoimmunity, patients who are organ transplant recipients, or people with HIV. Now that we've discussed the risk factors, we can discuss the signs and symptoms. So most commonly, a rash will acutely appear in one location in the body, mainly thoracic, In some instances, it can also appear on the face. The rash commences with erythematous papules along one dermatome of the body. The rash will appear as a vesicular and distributed along one nerve pathway based on the affected nerve where the virus was latent. A prevalent sign is that within a few days of acute onset of the rash, vesicles will appear in groups and they will turn into pustules. There are many complications of the disease. For example, something called herpes zoster ophthalmic, which is severe and can cause blindness. Also, people who are immunocompromised can succumb to severe acute retinal necrosis. Symptoms include pain associated with the rash. Often what happens is a vague pain will appear for a few days in the location of the affected dermatome or the nerve ending where the virus is dormant. And then pain will sometimes be described as sharp, constant, or intermittent. And a complication that can happen is when the virus happens near the eye, and post-herpetic neuralgia, the pain will persist over 90 days of the infection activation. Patients will also complain about paresthesia, numbness, itching, and allodynia, where the area of the virus is typically located based on whatever dermatome it was sitting latent in. Symptoms of severe conditions include headache accompanied by malaise or fever. The patient will complain of one-sided pain to either the eye or can sometimes exhibit hyperemic conjunctivitis or keratitis. This can lead to the development of vesicular lesions near the eye. And when acute retinal necrosis is occurring, there's a high risk for retinal detachment and loss of vision. So this is very severe, and we need to be really highly acutely aware of this. And patients will exhibit at this point symptoms of ocular pain and blurred vision, depending on which nerve is damaged from the latent virus. And lastly, we can discuss the diagnostic testing. This is important in diagnosing a disease. There is a clinical manifestation that is typically present, which helps practitioners diagnose this disease. However, there are some tests that are useful in diagnosing the disease. For example, a PCR test, also known as a polymerase chain reaction test, or a DFA test, which stands for direct fluorescent antibody testing. And the PCR test is typically very sensitive and detects almost everyone with the disease and can be useful when collected from the lesion. Also, we can perform a PCR from the blood, CSF, or vitreous fluid, as well as a bronchial lavage. And these tests are important in determining which antiviral medications can be used to treat the disease. And attached here at the end of my presentation are my references. So I hope you enjoyed my presentation, and I hope you enjoy the rest of your day. Thank you so much.